I'm Don Moss, the Dean of the College of Integrative Medicine and Health Sciences, and it's my pleasure to introduce our two speakers for this evening's program. The Dean Seminar was set up to allow us to feature the wonderful research completed by our graduates in their doctoral dissertation path. Tonight, I will begin with Robin Dickey, who is a 2015 graduate in mind-body medicine. Her title is What I Learned from Listening, an overview of a narrative exploration and embodied dissertation experience with female academic physicians. Dr. Robin Dickey is a licensed professional counselor and supervisor, National Board Certified Health and Wellness Coach, Associate Certified Coach, and Certified Worksite Wellness Specialist. She's the manager of the Faculty Assistance Program and University Ombuds Office at UT Health in Houston, where she supports well-being through counseling, coaching, and conflict resolution. She is an adjunct faculty member in the Mind-Body Medicine program. She received the Saybrook Dissertation with Distinction Award in 2020, and she is currently completing a Certificate of Professional Achievement in Narrative Medicine through Columbia University to further her exploration into the stories, well-being, and resilience of academic medicine. I welcome Robin Dickey to make her presentation. Robin, you have 30 minutes for your presentation and then 10 minutes of time for discussion.
All right. Well, thank you, and thank you all for being here. I'm excited to share with you my dissertation journey and also share some considerations since publication. This was published in 2020, so some stuff has changed since then. And also just let you know where this has taken me professionally. I find it nice to know when someone completes their dissertation that it contributes in more ways and that they're able to take their knowledge and their experience into their work. So I'll share a little bit of that as well with you guys. A little bit about me, you heard, as Dr. Moss shared. This is my email address. So if you're interested in any of the information that we talk about tonight and you want to connect, please feel free to reach out. I'm happy to make connections. I am currently the manager of the Faculty Assistance Program at UT Health and the University Ombuds for that university. And I sit on dissertation committees and I help out within the Integrative Wellness Coaching Specialization here at Saybrook. And I am completing a professional achievement certificate, a professional achievement certificate in narrative medicine because I just can't seem to get enough of this stuff. So I'm happy to share all this with you and have a discussion about it. So this was the name of the title of my dissertation, which was Embodying the Hero's Journey of the Healer, a narrative inquiry with female academic physicians. And I included these images here just to set the story and to set the narrative here about women in medicine and academic medicine specifically. There's this icon that's associated with differentiating men and women with the woman's wearing a dress, but I invite you to consider that maybe it's not a dress, maybe it's a white coat, and maybe it's a superhero cape. And I'll tell you from the stories that I've heard and that I'll share that both of those are true. And the purpose of my study was to explore stories and experiences of burnout and resilience among physicians working in the realm of academic medicine, and to understand their perceptions and use of the workplace wellness initiatives that would be at their institution, because that's the area in which I work. And the design, I made this to where I would be able to capture the subjective accounts of female academic physicians. So I conducted in-person interviews with them through a narrative inquiry framework. And I just want to take a minute to kind of discuss my rationale for focusing on women in medicine rather than all of academic medicine. So, a year before I started my research, which was August 2018, the Dallas Medical Journal published their quotes and stories that they've heard from people when they asked physicians if they believed there was a wage gap that it existed between male and female physicians. And if so, what the cause was and what could be done to address it. And this was a real quote that they posted. with their article. It says, yes, there is a pay gap. Female physicians do not work as hard and do not see as many patients as male physicians. This is because they choose to, or they simply don't want to be rushed, or they don't want to work the long hours. Most of the time, their priority is something else, family, social, whatever. Nothing needs to be done about this unless female physicians actually want to work harder and put in the hours. If not, they should be paid less. That is fair. So just invite to take a moment and like feel what that is like to hear those words and imagine being a woman in medicine and seeing those words being printed in a medical journal. So one of the people who read this was not so happy about it. And so she took to Twitter, which at the time it was still called Twitter, and said, Dallas Medical Journal proves that bias and gender inequality still exists in medicine. I work full time. I'm a board of director and executive member of my group, and I'm a mom. Shame on you, Dr. Gary Tiggs. Hashtag not cool, Gary. So this is where we need to restory, and this is why it's so important to understand the actual lived experiences of women in medicine. So that way the stories aren't told by their counterparts. So that tweet was retweeted many, many times over. Here are some examples of the voice and the story of women in medicine that wants to drown out that original article. They eventually retracted it. I don't know what happened with Dr. Tiggs, but it couldn't have been too great once the internet got a hold of it. But as you can see, some of these stories, I just got home from working my second 16-hour day in the past 40 hours. I'm exhausted. I cannot even find the words to describe how disgusted I am that a journal would publish this sexist content. So this was part of my rationale for wanting to hear the lived experiences of women in medicine. And as a review or perhaps an introduction to narrative inquiry, it's a qualitative theoretical approach that investigates how individuals construct meaning from lived experiences through the art of storytelling. And narrative inquiry embraces a three-dimensional approach to understanding and presenting information that's found within stories and throughout the process of storytelling. And that's temporality, place, and sociality, or the when, where, and with whom that's in stories, because stories are not static. And unique to narrative inquiry is this process of restorying. So I'll read this here. Rather than deconstructing stories, narrative inquirers continue re-examining story content to discover how a particular phenomenon may be understood in new ways through a process called restorying. It is through this restorying process that opportunities for change may be discovered. As both researchers and participants retell their stories through the inquiry process, they begin to explore how their sense of self or identity has been affected by the process of storytelling. So we're doing it right now. This is a process of restoring. We've changed the place and the context and the social aspect of which we're sharing these lived experiences. My research questions were very open and open exploratory. What stories do female academic physicians tell of burnout and resilience, and what are their perspectives on workplace wellness initiatives offered at their institutions? And how has my own experience throughout the research process as a co-participant contributed to the exploration and understanding of burnout, resilience, and workplace wellness initiatives with them? And that's an important aspect of the narrative inquiry process. We're co-participants. We collaborate, we construct the stories of this research process together. I had 6 female physicians who had been working in a full-time faculty position at an academic health science center or medical center in the state of Texas for a minimum of 6 months. We utilized a demographic information questionnaire that was presenting and requesting information related to what I found to be relevant and unique in the literature review aspects of the individuals that might have some kind of significant impression or an outcome that they've experienced related to experiencing burnout in academic medicine. They participated in 2 audio recorded interviews, and then those interviews were transcribed, which back then meant an online transcribing service that has much improved in the last 5 years as well. Now it can be transcribed while something's being recorded, which is amazing. And then participants also were invited to participate in a mindful breathing activity after sharing their stories of burnout, just so we can recalibrate, kind of reorganize our thoughts, come back to this moment in the research process pull them back from that story and be here now in the present, and then move forward into future stories that they wanted to share. And then I also had my own reflections and field notes throughout the process. So here's an excerpt from my dissertation I wanted to share that shows the value in having that follow-up interview, because it's through that second interview process where I was able to confirm some of the information that they shared and clarify that I'm not making generalized guesses or any assumptions about what was happening throughout the research process. It's all from them. So I found this person's lack of physical expression curious, considering the emotion that was expressed throughout her stories. I shared this observation with her during the second interview, and with a smile on her face, she explained how remaining stoic had become second nature when delivering emotional information to patients over the years. So she shared in her reflection that she got really good at making sure that people hear her words, not necessarily reading her face. And so over time, her demeanor would change and sort of mold into that professional identity. And so she found it quite interesting that she had her game face on, as she called it, while she was sharing these stories. So these reflections helped my observations shed light on that, what was actually happening, and she could share from her own perspective what was actually going on in that moment, which I very much appreciated. I had a really fun analysis process. I say that now, 5 years later. I'm sure at the time, if you had asked me, I may not have used the same type of descriptions. But the narrative analysis process looked like reviewing the transcripts, listening to the recordings, looking over the transcripts themselves, summarizing what I could, and revisiting my own reflections and seeing how they lined up. And then through that, I would create these categories of patterned or significant keywords, some themes that seem to be coming out from the narratives, and then try and find a way of putting them into these individual and collective summaries. And so I used quite a few different techniques. I was paying attention to what people were saying, what their nonverbals looked like while we were talking, and also just movements and things that were happening at the time. But I found that as I was going through this, I had a considerable amount of data, and I found myself just getting overwhelmed with trying to figure out, when sifting through all this, yes, there's patterns and themes, but what is making it significant? How do I find the meaning in all of this? And so I utilize what I call the Lindsay method, which was from Dr. Stephanie Lindsay, who was Saybrook faculty and also was on my committee, my dissertation committee. She had published information about an embodied analysis process. And so I read this, and through this process, basically, it invites researchers to engage with the data through sensory and emotional awareness rather than solely through cognitive analysis, in hopes of changing the relationship with it to find the meaning through an embodied process. There's 3 steps. So you experience the transcript, then there's moments of quietude, and then through that comes the epiphany and release stage. So for me, this looked like re-listening to the recordings, reading the transcripts out loud and listening to my own voice as I would say them out loud. And then I would go through a transcript, have a moment of meditation off to the side. At first, it was in the same office space, and then eventually I moved out farther and farther away from the data, so I had some separation from it. And then I would wait and see what would come from that receptive process. And so lots of things happened, and here are some fun visuals. So this is a drawing that I made after I was taking a moment in quietude, and I kept having these images of triangles coming up. And in my self-reflections and in my journaling, I would, and on the transcripts themselves, I would make little triangle symbols as a reminder that this is probably something significant, or this was a repeated phrase, or I found this somewhere else. And it reminded me also of the 3 points in narrative inquiry: the temporality, sociality, and place. So when I would focus then, after having this more externalized process with the transcript, I found myself in a better position where I could visualize those words and where they were, and trying to connect with the meaning in that way. And so I took some time and drew out some of the symbols and words that came to mind, like anger, shame, and guilt are in the middle there. And this was also a helpful process of just putting my mind and body to work at the same time after having moments of quietude. And so through this process and thinking about the triangles and then going back to those words, I revisited the transcripts over and over again. And then I would find which words really felt like they held deep meaning for the participants. And so I found some of these that fell into power, transformation, resilience, going into battle. And all of these words, when I would think about them, they've reminded me in the moment of someone who's on a hero's journey, which is a narrative structure that outlines a transformational path, usually found in mythological stories or in stories in general of growth and transformation, where there's a character who's moving through, they're taking a challenge on, they're going on an adventure, and they have these challenges and barriers that they have to overcome, and they do so successfully, and then they are forever transformed, and then they get to share their experiences of being transformed and look at that process differently. And so that's what I started to notice. And so I went back to the literature to see what I could find that links the hero's journey with burnout and resilience stories. And that's where I found the term moral injury, which I hadn't heard before, which is a psychological distress associated with violating moral or ethical values due to systemic pressures or repeated exposure to ethically challenging situations. This is in the literature mostly for, you'll see it for those that are in the military, and that dichotomy between being a warrior and also finding, feeling like killing is wrong or violence is wrong, but being in both of those headspaces at the same time. In the healthcare setting, that can look like being a healthcare worker and having requirements to pay attention to things about the business of medicine versus the healer identity. When someone is there for their reasons for being in medicine are to take care, to heal, to help. And so that's where moral injury can show up and be what the result of burnout can look like when you're repeatedly exposed to these situations that evoke this dichotomy. And so I pulled out more words of significance after I educated myself about these. And I kind of started putting them in like this chart here because I noticed then these are all associated with yoga poses. And I do yoga. So I would go back then to the transcripts and to the audio recordings, and I moved through these yoga poses so I could again experience the transcript on a movement level to see if I could feel the stories and then connect with a sense of empathy and really understand what they were trying to say. And that helped me convey their voices, I feel, more impactfully and not guessing or telling them what was significant from the data. They were telling me. And I discussed the term moral injury with them in their second interview. And that was a really interesting discussion overall. So, through that embodied process, this is how we got to some very significant findings. For gender roles and career stages, this is where the stories of resilience really seem to connect with gender roles and where they were in their career stages. I found that those who were newer in their career, they had access to mentors and those that could guide them through what they've already experienced or what helps them feel connected. And so they had an external resilience process. The way they moved through burnout was by this connection that they were able to build with those who are already in the field. And then also those in opposition to that, those in middle to late stages of their career, they felt like they were trailblazers for resilience. So they had an internal resilience process. That story was one that they had to create on their own. They had to move through it first, and then they could offer this to others that were up and coming behind them. And then also, there's a lot of stigma associated with needing to utilize the workplace wellness initiatives that might exist, their employee assistance program, seeking mental health support, or otherwise things that might be available to them. Also, many of them didn't even know they existed, and had they known, they probably would have utilized them more. So then there's this idea of the healer identity. And this was that sense of connection with others, being able to have this sense is what the term kind of ended up being through our discussions, the wounded healers, those of them who have gone through burnout and they are in a story of resilience. They had empathy for each other. And that connection is a tool for overcoming burnout. And then there was this discord between the healer and the healthcare worker. And that's that experience of recurring burnout. It's not to suggest someone maybe burns out once and then they're good. A lot of times, because you're still in that environment, in that institution where that moral or ethical dichotomy is happening, you're going to experience perhaps recurring bouts of burnout and therefore continuously needing to find and connect with that sense of what it is that helps you be resilient through that. And for them overall, the values overall through their stories seem to look like loyalty, integrity, and compassion. So when those values weren't being used, they weren't working through those values, or they were working with others who didn't share similar values and focused more on how they could be good healthcare workers, that's where that that sense of burnout might show up because why bother? Why am I in this? It's hard to connect with that sense of what you're doing is important, that it matters, and that it's part of your identity. And this is where that moral injury came through the guilt, shame, anger, and then the sense of betrayal by the leaders, those that were supposed to be on their side when hearing their stories of burnout and listening and trying to find ways from a systemic level to adapt and make the workplace an environment in which the physicians could thrive instead of feel like they had to find their own individual ways of surviving. So the main takeaways that I found that the results from the study revealed an imperative need to change the culture of medicine in order to mitigate physician burnout. There's a desperate need for advocacy from institutional leadership to command better working conditions for academic physicians. The development of peer support and mentoring initiatives solidify the foundation for strengthening that resilience. And it's important to note that burnout is only part of the story and resilience is only part of the solution. There's so many factors, individual factors, as well as institutional factors that play into these stories. And then also identifying factors that contribute to the experience of moral injury is a necessary focus in the quest towards physician well-being. So recognizing it throughout all of these different avenues in which we can consider a well physician in academic medicine. And so, again, I wanted to share just some considerations since publication because this was 2020. A whole COVID-19 pandemic happened since this. And so, my curiosity is taking me and wondering about what the key differences in workplace well-being, what that might look like pre and post pandemic, because the workplace changed in so many ways. And there's more understanding and utilization now of workplace well-being programs because it was brought into the forefront. So I found this report that was provided here, published by TLO in 2025, and it says that mental health leave days increased 300% from 2019 to 2024. So that was from 2% to 8% change in the total leave was for mental health. Is that because people were taking the time to care for their mental health? Is it because there was a need for mental health, just like physical health? Maybe it's both. This is where my mind is going. There's a quote here: in the new normal, we're seeing elevated levels of leave across the board, and especially for mental health. This means employers need to reevaluate both their approach to absence management and overall employee well-being to foster workforces that thrive. There's also been an organizational response that's been seen. 94% of large US employers enhanced mental health coverage since 2020. So the landscape is changing, and I'm really curious about that impact on academic physicians. Here's a completely hypothetical and made up narrative. Dr. Jay Cool was once known as a high performing academic physician. He was teaching multiple courses, leading a residency program, and working well over 40 hours a week with ease. When the COVID-19 pandemic hit, he contracted the virus and, despite recovering from the acute phase, was left with persistent symptoms of long COVID, which looked like fatigue, brain fog, shortness of breath. These symptoms drastically changed his capacity to perform. So now Dr. Cool finds himself barely meeting expectations. Tasks that once came naturally now require immense effort. He's had to reduce his teaching load, delegate leadership responsibilities, and shift to remote work when possible. The identity he once held with pride as a tireless healer, educator, and leader has been reshaped by his illness. Through this journey, he's learning to redefine success, prioritize well-being, and advocate for systemic understanding of invisible disabilities in academic medicine. So I provided this completely hypothetical made up narrative to show that there's some stories out there, and we've now had so much time since being in the middle of COVID, we can see the impact and what this looks like, not just for those who are working through it as healthcare workers, but for those who have experienced it for themselves and how it may have had an impact on their overall well-being. Another area that I'm very curious about is this up and coming ability and transformational experience with AI scribing technology. And I'm curious about the impact on physician well-being because particularly with burnout and moral injury, because one of the top contributing factors for experiencing burnout is the administrative burden, or pajama time, as it's also known. What people are having to do when you are a healthcare worker, you have documentation in addition to your clinical responsibilities. And if you add on educational experiences on top of that, that's a lot of administrative burden. So with AI scribing technology, this might have an impact on those experiences of burnout because it can have a reduction in administrative burden. The Permanente Medical Group, just this year in 2025, they did an analysis of their AI scribe services, and they saw a 10% drop in reported physician burnout in 2025 compared to the previous year. So just by implementing this, they've seen a 10% drop in those who reported burnout. It's also noted that time saving was experienced. Collectively, their physicians say the equivalent of 1,794 working days in 1 year using AI scribes. And then there's also some enhanced patient care. So that 47% of patients notice less screen time from their doctors, and almost 40% reported more direct communication during visits, which is very instrumental in someone who identifies himself as a healer versus a healthcare worker to have that opportunity to connect with their patients. So if that's being improved, perhaps overall well-being is also being improved. So these are some areas of consideration that I have found really fascinating and where like my mind is taking me with all of this. And then just in general, professionally, where this has taken me, I'm co-chair of the Office of Faculty Affairs and Development Faculty Wellness Council. This is created, there's representation from all the 7 schools that are part of UT Health, the faculty, and also the leaders. And our purpose is to foster a culture of holistic wellness that supports health, resilience, and productivity for UT Health Houston faculty. We have 4 main objectives. We're conducting surveys and focus groups so we can assess our faculty wellness across the different schools. We also want to increase communication and marketing efforts to raise awareness about the existing wellness programs and the new offerings, because that was something that I noticed from my participants. As I mentioned, very few even knew that they existed, and if they did, there was some stigma around it. There seems to be less stigma attached to utilizing mental health well-being services, and so we're trying to capitalize on that. Also, we're implementing wellness initiatives on our own. So already we have integrated some workshops on resilience, mindfulness, and burnout prevention. We are piloting our own AI program, which is very exciting. It's a very small program right now, but just from the ones that we have seen, there's a group of 25 of them, and they've already reported that if their shift ends at 5, they're home by 6 versus if their shift has been over by 5, they're home by 8, and then they still have pajama time where they're having to do all their documentation, which is a tremendous impact on wellness. So that's why we consider it a wellness initiative. And then because this is expensive, right now this costs about $200 per user. So that's why we're only piloting it. We're going to need some funding to support this. So we're looking for those opportunities as well. And then we also want to foster wellness education and training. So if faculty want to learn about how to be better educators, we want to put some wellness education into those training curricula. And then we also want to let people know that they can learn about wellness, and then we need to evaluate the effectiveness of our wellness education efforts. So that's a little bit about what I've done, where this has taken me with doing this. And I just want to thank you all for being a part of this restoring by continuing these conversations, because narrative inquiry doesn't end with the final dissertation chapter. It continues to evolve. And continuing the conversation honors those 3 dimensions of narrative inquiry. Where in it, the stories are not static. We're hearing past, present, and future of these stories. This is a brand new group that we've gotten to experience this with together, and ongoing dialogue deepens that relational understanding and fosters empathy empathy, connection, and shared growth, which I hope you all have experienced. And then the context is constantly changing. So by continuing the conversation, this allows the stories to be reinterpreted in new settings. So that's what I'd like to thank you all for not only listening, but being a part of this continuing of conversations with me. And also, here's a bunch of references in case you are interested in those.